Assalamualaikum. I am Arifuddin and with me is Shami. Today we will discuss CPR knowledge among healthcare workers at Sultan Zainal Abidin University Teaching Hospital. This presentation will discuss Chapter 1 Introduction until Conclusion. Chapter 1 Introduction. Sudden cardiac arrest is a major healthcare crisis in Malaysia and globally. CPR is a life-saving intervention, and as healthcare workers, we have responsibility to be skilled in this technique. That's why we conduct this study. We want to understand the current level of CPR knowledge within our hospital so we can target any training needs and ultimately improve patient care during emergencies. Research background. All healthcare workers have a duty to be proficient in CPR. It's the foundation of emergency care. CPR guidelines are constantly updated, so healthcare providers need regular training to stay current. Unfortunately, studies indicate that CPR knowledge among healthcare workers can be inadequate, especially in our region. This study aims to change that. By assessing CPR knowledge and skill at our hospital, we can identify areas for improvement. Problem statement. Research is clear. High quality CPR save life. This means healthcare workers at our hospital need to have excellent CPR skill. However, studies suggest that there may be gaps in knowledge and practice within our region, which is a serious concern. This study goes beyond just testing CPR knowledge. We will assess how well healthcare workers understand guidelines, their practical skill, and how they apply that knowledge under pressure. This will give us a complete picture of our CPR training strength and weakness. With this data, we can make targeted improvement to ensure our staff are equipped to provide the best possible emergency care. Our study has several key objectives. Assess if healthcare workers know the latest CPR guidelines. Evaluate practical CPR skills, focusing on compression and ventilation. See if knowledge varies between different healthcare roles. Understand what helps staff retain CPR skills. Evaluate the effectiveness of our hospital CPR training. Ultimately, we use this finding to make recommendations to improve CPR training and ensure our patients have the best chance of survival during cardiac emergency. Our hypothesis is that healthcare workers at our hospital might have gaps in their CPR knowledge based on the latest guidelines. We suspect knowledge level may differ between doctors, nurses, and other healthcare staff. Our goal is to identify this difference so we can improve training and patient outcomes. In Chapter 2, we will discuss about past research that are connected with our research proposal. American Heart Association 2020 mentioned that sudden cardiac arrest is a major global health crisis and a leading cause of death. CPR is essential for survival, keeping blood flowing to vital organs until further medical help arrives. The key to successful CPR is early action, high-quality compression, early defibrillation if needed, and proper aftercare. Healthcare workers' CPR skills directly impact patient survival. As Spinelli et al. 2021 stressed, it's essential they have the knowledge and ability to act quickly and effectively. Unfortunately, studies by Mersha et al. 2020 and Silverplatz et al. 2020 indicate that CPR knowledge among healthcare workers is often inadequate. This highlights a critical need. Lauritsen and his colleagues 2022 and Bay and Hong 2021 emphasized that regular individualized training is crucial for boosting healthcare workers' CPR confidence and skills. A common CPR challenge is getting the right chest compression depth. Compression that are too shallow are ineffective. Feedback device can help healthcare workers achieve the correct depth. Current guidelines recommend 2 to 2.4 inch, about 5 to 6 cm for adults.
So the next one is chapter 3, research methodology. So for the research design, we chosen a qualitative cross-sectional design as outlined by Muhammad H. Rabah on 2017. This approach allows us to gather data at specific point in time, exploring CPR knowledge level across different healthcare roles within hospital pengajar UNIZA. For the study population, we focus on diverse range of healthcare professionals, including doctors, assistant medical officer, registered nurse, medical student, and other allied health staff. Our goal is to get a comprehensive and representative sample of our hospital population. Since we want to target healthcare workers with various experience levels, we use non-probability purposive sampling. This allows us to specifically select our participants who fit our study criteria, giving us valuable insight into how CPR knowledge might differ across healthcare roles and level of experience. Before launching the full study, we will conduct a pilot study, similar to the work of Salimuddin and Sengler on 2016. This involved testing our survey on a smaller group of participants. This helped identify any unclear question, refine our data collection, and ensure the main study runs smoothly. We will use a validated questionnaire to gather data. This questionnaire assesses the background information like healthcare rules and experience, CPR training history, knowledge of CPR guideline, and CPR practical skill, which we will directly observe using mannequin. This combination of methods will give us a comprehensive picture of CPR proficiency at our hospital. We will analyze our data using statistical package for social science software. This includes descriptive statistics to summarize our CPR knowledge and skill level, statistical tests to see if there are difference between healthcare roles, chart and graph to visualize the result clearly. Our goal is to use this analysis to identify meaningful pattern and area for improvement. The chapter 4 is data analysis and finding. We will analyze our data to understand CPR knowledge at our hospital. This includes descriptive statistics to summarize results and potentially statistical tests to compare different healthcare roles. Chart and graph will help us visualize the finding clearly, and we also use software to aid in our analysis. Here are some possible findings. This is just hypothetical data only. Doctor might score higher on CPR knowledge tests than nurses, suggesting a need for targeted training. Recent CPR training might be linked to better practical skill. A common challenge could be getting the right chest compression depth. In Chapter 5, it will contain a conclusion, interpretation, and the discussion. In this chapter, we will discuss key findings like how CPR knowledge might vary between healthcare roles. We also explore what this means for training needs at our hospital. We also acknowledge any study limitation. We will suggest future research to explore specific CPR challenge or ideal training frequency. Next is appendix. Our research followed by several key steps. First, we choose our topic and review existing research on CPR knowledge and skills. We design our study deciding how to collect data, including questionnaire and practical CPR simulation. Currently, we are analyzing the data to find pattern and important results. And finally, we will use those results to draw conclusion and make recommendation to improve CPR training at our hospital.
Next, I would like to invite Sir Slamat for a brief question and answer session.
Okey, soalan saya untuk 4 research methodology. Tadi tajuk kamu asal tadi adalah cakap tentang nak tengok knowledge kan pada kalangan healthcare workers. Tapi kamu punya research design dalam tu kamu tulis target participant 300 clinical tu okey lah. Tapi itu non-clinical staff. Itu saya persoalan kenapa ada non-clinical staff tu. Itu soalan pertama saya.
As for question 1, non-clinical staff refer to jobs like patient care assistant, biomedical engineer, and many more. As we know, code blue can also occur at their department. So they also need to know how to do high quality CPR before emergency staff arrive to increase the survival chance of the cardiac arrest patient.
Okay, soalan kedua saya, kenapa tajuk kamu ni kamu nak buat kepada healthcare workers? Nanti kamu sertakan data-data lah. Kan adakah tajuk keletihan ke kepada healthcare workers ni? Kan CPR ni benda yang common kan. Benda yang common. Kenapa kamu nak fokus kepada healthcare workers tentang high quality CPR? Itu yang kedua lah. Kemudian nanti kalau betul benda ni berlaku, kamu nak buat research, banyak benda yang kamu akan tengok lagi nanti. Okay, itu saja soalan saya. Nanti jawab dalam tu, combinekan yang macam kita dah bincang lah dalam kita punya discussion yang lepas. Okay, thank you.
To answer the second question, we chose healthcare worker as a targeted group because according to Masha on 2020, current CPR knowledge among healthcare workers is often inadequate. So we emphasize the importance of raising awareness among healthcare workers about the importance of high quality CPR. Plus, mastery the high quality CPR ensure compliance with established guidelines and protocol, such as those outlined by American Heart Association or European Resuscitation Council. Adhering to this guideline promotes standardized care and improve overall resuscitation outcome. So that's all from us. Thank you.